Well, this is a really growing movement. I've been personally using ozone for 30 years. I was trained in Germany 30 years ago, when and they were using it a lot then, back in Germany. But I was one of the first people in the United States that ever utilized this thing. Starting, I used it for maybe close to 8-9 years before I thought, this is way too valuable a treatment for people not to know about. So we started doing educational seminars where we trained doctors.
My name is Dr. Herman Spies. I'm an integrative medical practitioner in Cape Town. In my practice, I mostly deal with patients with chronic degenerative diseases. So I see patients with Alzheimer's, motor neuron disease, multiple sclerosis, lots of patients with cancers, chronic fatigue, yuppie flu. And I find the ozone to be extremely valuable in my practice. I prefer to start detoxification in my patients by using the ozone machine. It gives the patient a nice gentle introduction into the detox. It takes the load off the liver, the kidneys and the lymph, so the patient just starts detoxifying without burdening any of their symptoms. Therefore we don't get the typical healing crisis, and instead of feeling first worse before they start feeling better, the patients enjoy the treatment and they just gradually get better.
How effective would you say is ozone rectal insufflation?
I would have to tell you, I think it's a marvelous therapy. Early on, the way I was trained back in Germany, and early on, the whole focus was on blood treatments. And blood treatments sound really good, don't they? We're going to pull blood out, we're going to treat the blood, infuse that right back into you intravenously, and it sounds very doctory and very medically, and it sounds like that's the best way to go. But you know what? What we're finding out now is that doing rectal treatments, which basically amounts to injecting ozone gas right into the intestines, through the rectum, injecting the gas literally right into the intestines. It will get absorbed that way. And exposing the skin, so transdermally absorbing it in the sense of a sauna. Drinking ozonated water. You can take water and you can heavily ozonate it, and then you can drink that. So we're learning that these may be as effective or more effective even than the blood. And what's really nice is you can combine them, so that we can have a patient come into the clinic and in one day we can have their entire intestines cleaned out and ozonated. We can have their entire skin, the entire surface of their skin, heavily ozonated, and then we treat their blood and we ozonate that. It's not easy to, it's not hard to understand why they get better.
Hi, my name is James Fleming, EP King's physiotherapist. Just to tell you a little bit about our ozone therapy that we've been using this season. We started off using it at the beginning of this Curry Cup campaign, July 2012, and we've found extremely good results with the ozone. The players that have been using it mostly have been the older players, as well as those returning from injury.
In my opinion, intravenous ozone compared to the Smith ozone chamber is very similar in results. Except that in the case of the intravenous ozone, you need costly technology. You need to use the ozonator machines. You have to use the expensive drip cannulas. It's a procedure to take the blood out of the patient's body, ozonate the blood and then put it back. We've tried that method. We also tried the method where we put the intravenous catheter into the patient's vein and we ozonated the whole body, the blood. But in my experience, the Smith ozone chamber gives you comparable results. The patients respond very quickly to the treatment. The patients really enjoy the sessions. Very often patients almost fall asleep in the chamber. So instead of staring at the drip and you have to measure the tempo that you inject the ozone gas, because there's always a risk of injecting it too quickly, now the patient can just relax, listen to nice music and at the same time get similar treatment. So I think it's much more effective, well, put it this way, as effective and much more enjoyable for the patient.
And we've been very pleased with the results in that. We've certainly found less bumps and bruises. Players have been much more sort of energized and revitalized than they had been previously after games, as well as after training sessions. We've also found, as a result, we've had a lot less absenteeism from training, and therefore been much better prepared, or better able to prepare for matches on weekends. So far so good. We've been very happy. The players have certainly come back positive, and don't want to miss out on having that ozone therapy, which is a good thing, I believe. And myself, on a personal level, I've also managed to slip into the ozone a few times, and definitely find myself more energized and revitalized to help look after the team as best I can.
You've been using the ozone sauna for quite some time.
Yes.
Can you give us a little bit of, just give us some background of your experience of that?
Well, we've been using an ozone unit in here for, an ozone sauna unit for, I guess, about 9-10 months. And we've used it a lot. It's extremely well tolerated. The patients love it. It's very relaxing to them. It's very therapeutic. I mean, we do see great results. People will have, you know, they'll get 3 or 4 saunas under their belt, and you know, it's hard to like absolutely focus on that because we do other things at the same time. But I will tell you, my initial impression of it is it's a very valuable tool. I'm glad we have it here in the clinic. Okay, here's the sauna unit that we use. It's a beautiful, beautiful unit. It's strong. It's heavy. We never have any problems with it. It works. It's very functional. Has an oxygen behind it, and so this sauna, we will pretty much be using this all day today. And then over down here, right in here, is the other way that we use ozone. So this is a colonic room. So what this does is you irrigate out the patient's colon and clean it out, and then we pump ozone gas through it. There's the ozone generator. So we pump ozone gas into the colon, clean it, pump more ozone gas in, clean it, and it's fantastic. This is just awesome. So ozone colonics are awesome. So patient will come in here, get that, they'll move right on over there, do the sauna. By the time they've done those two, they're already feeling great. But we've got more, actually, than that.
One of the patients that I saw profound effects after giving the patient ozone treatment was a lady in her 70s with blood circulation impairment to her legs. The lady had been to several physicians and neurological specialists, and they eventually suggested that she gets treatment or a surgical solution to sever the nerves in her spine to remove the pain sensations from the feet traveling up the nerve pathways to the brain. The lady was on repeated or a whole lot of conventional medicine that gave her a lot of side effects. She was totally constipated, had constant headaches, and we then decided to put on the ozone treatment. We did 14 days of ozone treatment, and after stopping the medication and just using the ozone, 14 days later her symptoms have improved by 80%.
Not only have players felt a lot less sore after games, but they've also been able to recover quicker for the trainings in the week, and therefore prepare better for matches every week. We've had a long campaign with 14 league games and a semi-final, and our injury count and our training availability has been